Thank you. Good afternoon. Well, dear colleagues and experts in the fields, and ladies and gentlemen, it is really my great honor to have this opportunity to share with you the measures in the control of communicable diseases in Hong Kong. So actually, I see my former bosses here, both Thomas and Dr. Lam. And the work that I'm going to present today, the work on the control and prevention of communicable diseases and the preparedness and the response actions, and actually majority of the work I present here is the work and contribution by my former bosses. So it's really my pleasure to be able to be the presenter here. And they laid down the great foundation for us to carry on, and we are very grateful to them. So after Professor Perez's presentation, he gave a very vivid picture of several epidemics in the past few years. So I hope my presentation won't be a repetition of you. And if there is any repetition, please bear with me. So first of all, let me put you into the perspective of the Hong Kong public health system, because it's essential to the whole strategy in the preparedness and response framework on communicable diseases. So I will spend a few minutes to share with you the structure of the public health systems and the related government organization structure here. So the Hong Kong health system is under the administration of the Secretary for Food and Health, and under the government structure, the Chief Executive is supported by the Chief Secretary for Administration, the Financial Secretary, and the Secretary for Justice. So the Food and Health Bureau, which is headed by the Secretary for the Food and Health, is one of the 9 bureaus under the Chief Secretary. And this bureau is committed to building a healthy society and accountable for formulating related policy. So the policy on prevention and control of communicable disease is under the Secretary for Food and Health. There are 5 executive departments under the Food and Health Bureau. So the Department of Health is the executive department which carries out the public health functions of the government. So the Food and Environmental Hygiene Department is responsible for the food safety and to maintain a clean and hygienic living environment for the people of Hong Kong. So the Agricultural, Fishery, and Conservation Department is responsible for ensuring a reliable supply of food, a safe and high-quality food, and including the livestock, live poultry, and to maintain a well-natural environment. So in contrast, the Hospital Authority, which is not a government department, but it is funded by the government and is managed by an independent board in which the Director of Health is the board member. And it is responsible for the provision of public health and public medical services for curative treatment. The Center for Health Protection is the professional arm of the Department of Health for the disease prevention and control, and it is headed by the controller who reports to the Director of Health. So let me give you a brief background on the Center for Health Protection. And it is established in June 2004 upon the recommendations made by the SARS Expert Committee report for the SARS outbreak in 2003. The vision of this center is to be an excellent center in disease prevention and control, and its mission is to achieve effective prevention and control of diseases in collaboration with major local and international stakeholders. So it coordinates and implements the public health programs in disease prevention and control. And you can see here, there are 6 functional branches and which contribute towards the multidisciplinary health protection program. So I would like to highlight a few branches to illustrate how the different branches work together in the preparedness and control of communicable diseases. So the first branch is the Surveillance and Epidemiology branch. It is responsible for the surveillance and control of communicable and non-communicable diseases, and also conduct the health promotion activities and give advice on the public health issues to the community. The second, on the left-hand side, is the Infection Control branch. It develops, promulgates, and evaluates best practices in infection control, organize trainings in infection control, and support epidemiological investigation of communicable diseases outbreak in hospitals. And the third branch, actually, I'm in charge of this branch, and this is the emergency response and information branch. It develops contingency plans and coordinate exercise and drills to enhance the overall preparedness for public health crisis, and to formulate risk communication strategies and coordinate and formulation the center's objectives and strategies. The public health laboratory services branch on the right-hand side, it provides the clinical diagnosis and public health laboratory services for surveillance, prevention, and control of diseases. And it acts as a reference laboratory in providing confirmation service and technology and training for laboratory personnel. And the one underneath is the Program Management and Professional Development branch. It is secretarial support to the Board of Scientific Advisors and various scientific committees under the center. It coordinates the applied research programs in collaboration with hospital authority, universities, and other government departments. And through the active participation of experts at various scientific committees, and Professor Paris is within one of these committees, we try to tap into their brain. And then it will provide the broadened perspective to disease prevention and control. So the center formulates comprehensive and effective strategies that reinforce the local health protection system. So actually, I want to point out here, one point is that the work on prevention and control of communicable disease, the preparedness and the response actions is not the work of a single department, and it is a collaborative work and concerted effort of all the departments in Hong Kong, and actually it is the work of everybody. So the Center for Health Protection is the cornerstone in the prevention and control of communicable diseases. Prevention, preparedness, response, and recovery are the essential steps promulgated by the World Health Organization for the prevention and control of communicable diseases of epidemic potential, particularly in the crisis situation. So I'm going to talk about this preparedness and response. We come up with the following 6 strategic directions for the control of communicable diseases. The reduction of the risk of human infection, early detection, rapid response, emergency preparedness, risk communication, and fostering collaboration. First of all, let me talk about the reduction of risk of human infections. Prevention is better than cure. The first step is to empower the public with proper and adequate knowledge. For general public, we enhance our publicity on infection prevention and control messages through various channels. So not only the general public, we pay special attention to hotel industry, driver, crew, and operational staff of the public transport, workplace, properties management, schools. So their knowledge and upholding of important prevention and control measures, in particular the personal and environmental hygiene measures, have great impact on the community. Another high-risk group is the healthcare providers, healthcare workers. We have produced specific guidelines on infection control and the use of personal protective equipment and disseminate to all healthcare workers in their healthcare settings. So this not only aims at the doctors, at the general practitioners' clinics and hospitals, but also to the Chinese medicines clinics and elderly health centers. We organize clinical infections and public health forum to reinforce their knowledge. Demonstration on the donning and dosing of the personal protective equipment was conducted. This is an important measure, especially in the control of the Ebola virus disease. Another strategic direction is to prevent people from getting infected when they travel overseas. So to this end, we actively communicate with the World Health Organization and relevant health authorities to obtain latest information about the infectious disease overseas. We update the list of affected areas and countries of some important diseases with epidemic potential, and actively provide information to travelers and health and the travel industry, in particular the Travel Industry Council. So we disseminate the health information through our dedicated travel website and distribute the pamphlets and make public announcement to outgoing travelers at all border control points. For the prevention of avian flu, which is very prevalent in neighboring areas, we implement additional measures to prevent the importations of infected birds and poultry, and to prevent our birds getting infected. So import control is implemented to only allow the import the healthy controlled birds. So enhanced surveillance is conducted for poultry and wild birds. For bird and poultry farms, biosecurity and hygiene measures are implemented, and health education, information, and guidelines are provided to farm workers. So in addition, the backyard poultry is prohibited. The second principle is the early detection of human cases. I think this point Professor Paris has already stressed on the importance of the early detection. So for this, a strong legal basis is important. To this, we have in place the Prevention and Control of Disease Ordinance and its subsidiary regulations, which provides for the measures for the prevention and control of infectious diseases and enables the Director of Health and health officers to implement the public health measures and enable the compliance with the requirement of the international health regulation. In particular, it provides us the power on the quarantine and isolation of cases and suspected cases, preventing cases and suspected cases from leaving Hong Kong, prescribing disease control measures, time and place of cremation and burial of dead bodies, and in emergency situation to enact the public health emergency regulations. So first and foremost, the ordinance requires every medical practitioner to notify to us the notifiable diseases as listed in the ordinance. For example, the H5, H7, Ebola virus diseases, and Ebola virus are made statutorily notifiable in 2008. So to facilitate the medical practitioner, the healthcare professional, to timely notify to us the notifiable diseases, actually we have in place a number of measures here and facilities. So you can see here the central notification office use all the means to encourage the healthcare professional to notify to us. So you can see here the fax number, the telephone number, the email address. And they can also download the forms in the internet. And so for all doctors, we have an online system. It is called the Seno online. And for the public hospital, we have already implemented a direct link to them through these NDOS, these notifiable diseases and outbreak reporting systems. So this is the Seno online. So apart from the legal framework, we have in place in Hong Kong a number of surveillance systems. So namely, the Sentinel surveillance system, the institutional outbreak surveillance systems, and the hospital surveillance systems, the laboratory surveillance systems. So this Sentinel surveillance systems covers the regular inputs from our partners of general outpatient clinics, private GP, Chinese medical practitioner, elderly homes, and childcare centers. You can see during the past, well, more than 20 years or 10 to 20 years, we have implemented in phase these kinds of Sentinel surveillance system. And one point I would like to highlight here is the media monitoring. You know, the civilian awareness sometimes precedes many formal surveillance systems. That is why we have a dedicated team to screen the media for any abnormal signs. So we screen all the newspapers in Hong Kong and some important online news overseas, and some public health links and online news too. So to guard against importation of the case of infectious diseases, our border is an important defense line. So we have temperature check at all border control points. So when we detect suspected cases for some disease of epidemic potential, such as the EVD, the avian flu, the Middle East respiratory syndrome, we will refer them to the public hospitals. So for EVD, we provide health information on the disease to travelers coming from the affected areas and countries and ask them to approach the port health office at the border. So not only the usual public health announcement and poster, which I have already mentioned, so we also started for the EVD to ask the travelers from the affected country to fill in the health surveillance questionnaire. So we continue to maintain regular and real-time exchanges of information with mainland, Macau, World Health Organizations, and relevant overseas health authorities. So rapid response is the motto of the Center for Health Protection. We ensure that for every suspected and confirmed cases, we must promptly conduct epidemiological investigation and implement investigation intervention measures. So these public health measures, which are listed here, the prompt investigation, the contact tracings, the active case finding, the isolation and quarantine, the environmental surveys, control measures and medical surveillance, while in epidemic situation, all these measures are further enhanced. And we also have the rapid diagnostic test in place to ensure the timely confirmation of important diseases. So preparedness comes second to the prevention. So apart from the legal preparedness I have mentioned just now, we have in place a three-tier preparedness and response framework. The preparedness and response plan, which outlines the command structure and action for 3 risk-graded levels of response, namely the alert level, serious level, and the emergency level. And actually, we have published online the 3 plans here: the pandemic influenza plan, the Ebola virus disease plan, the MERS plan. They are already online. At the alert response level, the Department of Health, the Hospital Authority, Food and Environmental Hygiene Department, Agricultural, Fishery, Conservative Departments, they are all headed by the Secretary for Health and Food. These departments are geared up to enhance the prevention and control measures. When the serious level is activated, the Secretary for Health and Food will chair a steering committee to command the intervention measures, conduct risk assessment, and monitor the development. When the emergency level is activated, it is the Chief Executive of the Hong Kong Special Administrative Region government to chair the steering committee, and he is, at that moment, will be the overall commander. So when we activate or deactivate a various response level, we will consider the following factors: the transmissibility of infection, the geographical spread of disease in human and animals, the clinical severities of illness, the vulnerability of the population, the availability of preventive measures, recommendations by the international health authorities. For alert level, the objective is to prevent importation of disease. The risk of causing serious impact, the health impact, is considered to be low. So it usually refers to a situation that the sporadic or cluster of cases occur outside Hong Kong. For serious level, the objective is to detect and contain early the infection. The risk of serious health impact will be considered moderate. It usually refers to the confirmation of sporadic cases, usually imported cases in Hong Kong. For the emergency level, the objective is to minimize mortality and morbidity. The risk will be considered high and imminent. It usually refers to the situation that there is evidence of local transmission of the disease which is sufficient to cause sustained community-level outbreak. So apart from the master plan of the preparedness and response I have just mentioned, we have also a hardware in place. We have this Emergency Response Center, the Outbreak Intelligence Center, the Risk Communication Center, the Emergency Hotline Center. And this will be activated when the situation becomes serious. The Emergency Response Center is the central hub to coordinate the command and response by various government departments for all the intervention measures that we implemented. So it feedbacks the outcomes and the new information to the senior management of the government for continual risk assessment, and for planning for further actions. The Outbreak Intelligence Center is the command center for the epidemiological investigation. The Risk Communication Center is a center we hold press conference and to convey our risk assessment to the public. We also provide essential health advice to the public. The Emergency Hotline Center consists of a team of well-trained healthcare professionals, usually the public health nurses. They will receive calls from the public. It provides a direct channel to allay the public concerns and to educate people, and it sometimes helps in case funding. For medical facilities, we have dedicated infectious disease hospital, which handle the avian flu, the MERS, and the Ebola cases. And there are also these designated clinics for triaging patients with influenza-like illnesses at the primary care level. We have also stocked up 3 months stocks of personal protective equipment and will replenish them timely. And we also have arrangement through the deployment of our staff to increase our search capacity. So practice makes perfect. We have regular drills and exercise to test the procedures listed in our contingency plans. The exercise helps us to review, refine the workability of the contingency plans, and enhance the coordination of different government departments. For example, in order to gear up our preparedness on Ebola last year, we have conducted exercise on disinfection and cleansing of the household, the quarantine of contacts in quarantine centers, and also exercise at airports and in the air flights too. Since the establishment of the Center for Health Protection, we have conducted 18 major ground movement exercises and drills. And this year, we have already conducted a drills on plague, and we are going to conduct another drills on the cruise ship. To empower the public and to recruit them in our team to fight against the communicable diseases, we need a risk communication strategy. Our strategy targets the general public, medical profession, community leaders, NGOs, travelers, business sectors, and utility, etc. So the following 2 slides, I'm going to list out the means and the targets on the risk communication. So we issue letters informing our healthcare partners the situation of communicable diseases, our intervention measures, and our appeal for our stakeholders in notification and upholding of prevention and control measures. The healthcare partners include the healthcare professionals like doctors, private hospitals, Chinese medical practitioners, clinics in hospital and in HA and NGOs, and also there are associations and trade associations. So we also issue similar letters to schools, childcare centers, universities, elderly homes, and disabled homes. So not only letters, we issue press release, make multimedia production, conduct briefing, forums, and meet community leaders at a district council meeting. The Secretary for Food and Health hold interdepartmental meetings to lead the preparedness actions, and the controller will brief the relevant government departments on the work. So we conduct briefing to industry and community leaders through various community groups. We brief the scientific committee members, who are our academic and science partners. So we brief our overseas stakeholders through the Hong Kong Economic and Trade Offices and Consulates. So for general public, we employ the websites, thematic websites, TV, radio broadcast, rolling text. So we even pay numerous visits to relevant community groups. For example, last year, in preparing for Ebola virus infection, we actively visited the local African community cluster at the Chongqing Mirada Mansion. So all our actions that I have already mentioned so far can be threaded through by this final principle, the fostering collaboration. We adopt a whole society approach to empower individuals, families, and special communities, coordinate efforts from various experts in healthcare sectors, and engage other sectors in the whole industry, the whole society for a concerted effort in fighting against communicable diseases. So not only within Hong Kong, our close partners are health authorities in mainland Guangdong and Macau regionally, and internationally, the World Health Organization and other overseas health authorities. So I have already spent 30 minutes for a brief introduction on the control of communicable diseases and the preparedness and response works that our departments have already done. So thank you very much for your attention.
Thank you, Dr. Kwon. We have time for one question. Is there any question from the floor? Yes.
Thank you for the very comprehensive presentation of the system in Hong Kong to respond to communicable disease. My question is about the contingency plan and the response level. At which level do you consider the government of Hong Kong is ready to receive and seek for international assistance? And to what extent do you think the Hong Kong legal system is ready to receive international assistance? I ask the question because after many international disaster relief operations, we as humanitarian organizations often find it very difficult to, for example, deploy foreign medical teams to a country affected by disaster or outbreak of disease because of various, national laws. So to what extent Hong Kong is ready? Thank you.
So I hope this situation never happens in Hong Kong. So I think the government will have open positions here. And you see that all the response level that I have already mentioned, and we actually based on the 6 principles, the 6 considerations that we activate or deactivate various kind of levels. And actually, for the control and and response to epidemic, it is progressive actions, and we have to do the risk assessment at various levels, look into the effective outcomes of the intervention measure that we have already taken. So I think there is no strict and fast rules and when we're going to receive or ask for help for the international organization. But I do think that the government will have open positions in various aspects. As already mentioned by all the speakers here, is fighting the communicable diseases worldwide is not a single effort of a single department. So we need the collaborations of all departments and organizations in this aspect. Thank you.
Thank you, Dr. Kwon.